Good morning. I'd like to call the December 8th Human Services Committee meeting to order. First on the agenda, we have approval of the printed agenda.
So moved.
Support.
We have a motion and support. Any changes, additions to the agenda? All in favor? Say aye. Aye. Opposed? The same. Motion approved. Next is public comment. Are there any individuals that would like to address the board? Seeing none, we will move on to committee items. We have the minutes of the November 10th meeting. We have a motion and support to approve the meeting minutes as presented. All in favor say aye.
Aye.
Opposed? Motion passed. Lifeway's monthly report. Miss Mary Beth?
So good morning, Commissioners. Right in your packet, you'll have my report for this month. First thing it highlights is related to our audit. As part of the Mid-State Health Network region now, they are auditing all of the community mental health as part of their contract requirement with the department. And we were the first ones to be audited under those new standards. And what you'll find in your report are some identified strengths for Lifeways, and so I just want to highlight a couple of those. First one is related to our process related to quality improvement and ensuring that our network providers submit data to meet the elements that are required for Mid-State Health Network for billing. And why that's important is because our funding, how they determine the capitation payment for Medicaid is based on that data. And so ensuring that we have a process where we monitor and track our providers to ensure that they're at 95% compliance or greater related to the integrity of that data is critical. So that was a strength. They also talked about our credentialing process as being best practice in the region, as well as our juvenile diversion services. So I thought you would like to hear that as well. The other thing they did point out is some areas for improvement, and they relate to some of our monitoring of data. One of them is related to adverse side effects within our physicians unit and prescriptions, so we are going to be incorporating that. The other thing was related to ensuring that it's a new standard that you have a process in place whereby individuals who are coming for services, they actually get an estimate of what the costs of those services are annually as part of their planning. So we will be incorporating that. The other thing that's happening starting in January is our annual financial audit. It's a two-part component in which the first part is the actual audit itself, and then after that is a compliance audit. That will occur in March, and our intent is to present to the board in March or no later than April the actual final outcome of our financial audit, and I will be sharing that with you after that time. Starting today, actually, is our intensive crisis stabilization service started, where we are providing a service that will help offset the cost of inpatient services by providing a very intensive in-home or wherever the individual resides services where they'll have either family therapy, individual therapy, but the supports needed to resolve the crisis versus having them go into an inpatient setting. So I wanted you to be aware of that service. There are an announcement also related to our chair. Tony, I don't know if you've had a chance to meet Tony Lewis, but he has been appointed as the chair for the State Suicide Coalition, and they're going to be making a formal appointment as that chair in December. That's a great thing for Lifeways, as we really have worked hard this year to move Suicide Coalition, both internal to Lifeways and as a community as part of that coalition forward. So that's great. Things that are happening statewide that you should know about legislatively. First thing is related to the bill that's out there, actually Senate bill. It's at the federal level and the state level There's two bills, but they both relate to each other, but it's about allowing individuals who are in crisis to be able to communicate with family members. The mental health professionals, right now, there are restrictions that prevent us from being able to do that. This would allow that to happen, and we know many times that that is a critical component in resolving a crisis, is to be able to talk with those natural supports for an individual. So we're hoping that those will pass. There's another bill that's out there that you need to be aware of. There are two bills that will actually change the definition of the population of people that we serve. Two of them. First one is Senate Bill 1094, and this would actually add veterans to the definition of priority population. There's a pilot occurring in two counties, Kalamazoo and Ann Arbor, in which they are providing, the community mental health is providing services to the veterans. This will help by allowing us to be able to meet the unmet need as far as waiting lists for people getting into access for mental health. The challenge is related to funding. The concern is that this is a federal requirement for providing services for the vets, and that we need to ensure that there is funding that goes along with this bill, or otherwise it's going to have to come out of the general fund of the community mental health, in which we have seen a 70% reduction over this past year. The other bill, and this is one that's important for the counties to be aware of, is Senate Bill 1098. This bill would again increase the definition of individuals that are priority for the community mental health, and they would include the individuals that are court-ordered placed through DHS into long-term residential settings. Now, while that will be beneficial to the counties, and the community mental health see the benefit of the CMH doing that. Again, this is a bill that's out there, and it actually has already gone through the Senate Family Committee, is that it does not have a financial impact analysis related to what that impact's going to be on the community mental health, again, because that would have to come out of general fund. So both of those bills, while they would expand the population for Lifeways to serve, the concern would be the still continued reduction in general fund dollars that we have available to do that. And so there's a lot of advocacy happening at the state level to say, please do an analysis of what that impact would be on the CMH. But that would be beneficial to the counties. The other thing that we've been looking at is a fiscal year 15 supplemental bill to address the GF cuts and the fact that there are still needs within the CMH system that aren't being met because of the significant cuts this past fiscal year. We were hoping that that supplemental would pass, and it has not. What we're hearing is that it probably will not happen during lame duck, that it will wait until the beginning of next March, probably, before it will actually happen. The other bill that's out there related to substance abuse is House Bill 4891, which I think I've mentioned that here before, is that it would take some of the revenue related to alcohol taxes and divert that for substance abuse treatment. So that is also a bill that is making movement. And when you look at the funding for substance abuse over the past 5 years, they have had we think the community mental health has had a significant impact. Substance abuse has had even a greater impact related to the reduction in funding that they've received. So this would be a good way for them to create sustainability funding for them into the future. The last one I wanted to mention was about Kevin's Law. Kevin's Law, there's an amendment out there related to expanding the individuals that would be eligible to be included under Kevin's Law, and that's when a judge would order treatment for somebody who's non-compliant with a common thing is not taking their medication. By doing that, again, this would be an area in which it would then be, this community mental health would then be mandated to treat these individuals because they would be court-ordered to the CMH, because they would expand the people that would be eligible to be able to be court-ordered. The recommendation from the Association of Community Mental Health Boards is that they ensure that this continue to be funded through the judicial system and not through the community mental health. That they also look at doing a pilot for a short period of time, maybe 3 or 4 different counties, to look at what that financial impact would be. So I just wanted you to be aware of those things that are out there. And that is it for my report.
Thank you. What comments or questions might you have? Thank you very much for that information.
Thank you.
Next on the agenda, we have Department on Aging monthly report.
Good morning, Commissioners. As I mentioned last month, our senior nutrition site on the south side of the city of Jackson, the building had to be closed, and we're trying to find another location, and we had very positive conversations with Chalet Terrace. It's a senior housing complex at Chalet Terrace, and it's in that same vicinity. We just need to get documentation sent to the state of Michigan, such as proof of a fire inspection. So that documentation needs to go to the Area Agency on Aging and then to the state, and they give final approval for us to relocate a nutrition site. So we're hoping by Monday that we could open the site at another location. Another thing we're working on is helping Friends of Jackson Seniors. They're a nonprofit organization that is local to help support senior services in Jackson County, and they're working on the first fundraising event for Meals on Wheels. And so a letter will be going out to local businesses this week, we think. We're waiting to be sure that the Friends website will be launched or active before we send out any information. And the website address is in my report, but once we know that the website is accessible, I'll let the county administrator know that that's happened so that you all can have the link to that website, because there'll be a lot of good information there about Friends of Jackson Seniors and Meals on Wheels and raising money for Meals on Wheels. And the campaign is called Soups On for Seniors. And thinking of Meals on Wheels, we had a gentleman who started Meals, and I taped part of his voice message to say thank you for the meals. He called the first day he got the meals and said thank you, and this is his call on the second day that he got meals, because I cut out his identifying information. Just hoping it would open. Well, maybe it's not going to work.
Your Meals on Wheels program, and I had the second delivery today. I'm calling to thank you again for these wonderful meals. I haven't eaten this well in years. I'm inclined to call you every day, but I won't bother you. I just want you to know how much I appreciate what you're doing. Thank you very much.
So, thank you on behalf of him. So, okay. Any questions?
Thank you, Marcy, and thank you for sharing that audio.
Nice.
What comments or questions might you have for Marcy? All right, thank you. Next on the agenda, we have the Medical Care Facility Quarterly Report and Financials. Director Place, and I see her very, very supportive board, all 3 members behind her. Thank you.
Yes. Well, good morning and happy holidays to everyone. I'll start with finance, and you all received your reports, okay? Our AR days out are at 58, which we've dropped 1, which doesn't sound like much, but that's a lot of work to drop even 1, so we're pretty proud of that. And it is an acceptable level for our business. Census at JCMCF is now above budget at this writing, and we are at 94.5%. This is the highest number that we've had for the year. We're pretty excited about that. We will still fail to meet our 51,000 Medicaid days this year to lower our bed tax cost, and that takes place in the fall. Budget work is nearing completion for our 2015 budget and will be presented to the board very soon for their review. Staffing levels and expenses have been reviewed along with the impact of changes for the dual eligible system. Even though we are not part of the pilot project, the providers of insurance in our area are dealing with many who are, and so are already trying to negotiate with us. All financials, bank statements, AP processing, AR, and financial issues and concerns have been reviewed and acted on appropriately. JCMCF monitors hospital readmission rates, and we surpassed the accepted standard for Medicare hospital readmission rates, which is a very good thing. We've been running between 6 and 19% of those particular admissions, but we average right around 12, which is significantly under what the acceptable standard is. Our bond interest payment was made timely, and I did attend the Fall Financial Conference up in Mount Pleasant in early November. For people, we have various evaluations that have been completed timely. We've again been able to keep cost of benefits below the public workers' ceiling, which is a significant savings for us. Union negotiations are completed with AFSCME 139 and 2098, and MNA wage reopener begins this week. Residents voiced no recent concerns. Things are going very well at our resident council meetings. Our morale improvement team continues, but now has widened its scope to include development of person-directed culture, both for our residents and for our staff, and will be undergoing a name change. Our United Way goal was, we didn't make our goal this year, but we really set one that was significantly higher, so maybe we'll be a little bit more reasonable next year and make it. JCMCF added a part-time case manager to better manage all of our referrals, and we have already seen good results from her being on the team, as you can see with our census numbers. Under service, we continue to work with regional and county emergency preparedness groups. We are planning a desktop drill this upcoming, I think it's next week, the middle of next week, and we're also becoming part of the long-term care work group for Jackson County. Step 2 grievances have all been heard and resolved at that level. Directors and the board did our strategic planning for the year at the end of October and set our plans, both short-term, mid-term, and long-term goals for the upcoming 10 years. We had our annual Harvest Home Dinner, which was a huge success, and the families love that. It's one of our highlights of the year. And Santa does arrive at Jackson County Medical Care Facility on the 19th with a bang. So if you're around between 2 and 3, pop in and see that really, really joyous event. Under quality, our policy and procedure team continues to meet and review policies as needed. All of our incidents and accidents are reviewed for residents on our point-click care electronic medical system, and then we have still use a paper program for our employees. We're currently free of any survey issues. This is about the 3rd month in a row now, and pretty excited about that. That's very helpful to us. We continue to review quality statistics comparing our outcome to state and national averages, and we are pretty much ahead of the game on the ones that are of significant interest to CMS this year, and that is antipsychotic medications, pressure ulcers, our turnover rate, and our hospital readmissions. We've also partnered with Lake Superior Quality Initiative, which is taking over and working with Advancing Excellence in Michigan, and we have a 3 to 5 year project going with them. Under growth, we continue to explore ways to use the acquired space from Joey's and Respite, and to continue working on sustainability for JCMCF. And this week, tomorrow, on Wednesday, and on Thursday, with Thursday being the big day, we are celebrating 175 years of being Jackson County Medical Care Facility. We started, as you know, for the poorhouse. We've blossomed and grown, and we are the leader in this area in person-directed care. We're going to do a time capsule, which is really kind of unique, and we have a lot of really good ideas for that. If you think of anything that you may want to go in our time capsule, be mindful it's only about this wide and about this tall. Please let me know, and we'll make sure it's included in the celebration and the ceremony that we will have at 2:30 on Thursday, and if you're available, we would love to see you there. That concludes my report.
Thank you, and also notice in your packet you have the August 2014 financial statement from Medical Care Facility as well. What comments or questions might you have for Sandy? Mr. Overton?
Did I hear you say that you completed negotiations with ASME?
Yes.
If I may inquire, the economics of that, how did that come out?
We stayed within the budget that we were given to work with for this year. It was, for 2098, we did, they had some wage compression, so we fixed the wage compression, but in doing so ended up a little bit less than what we were budgeted for this year, and then on 139, we stayed within the budget that was approved. You're welcome.
Anything else, commissioners? All right, thank you for that
Thank you
information.
so much.
Next on the agenda, Health Department. Richard?
Good morning, Commissioners. I have a pretty lengthy report for you this morning, obviously in the board packet, and we seem to be as busy as ever, if you will, on many things that I've updated you on previously. The Jackson Health Plan Corporation asset distribution process is moving forward, and I'll keep you informed as we get into 2015 on what the board decides to do with those resources to support the medically underserved and high-risk populations in the community. We're continuing a lot of work on Ebola preparedness. We participate in weekly or bi-weekly teleconferences with the Office of Public Health Preparedness, both for local health departments, but we also participate and listen in on the hospital preparedness calls as well. They're two different calls, they occur at different times, but we want to keep ourselves informed on both of those. We've had one tabletop exercise already take place with first responders, 911 Central Dispatch, and emergency managers, just to help them understand and fit their roles into emergency response for Ebola. And I think that went very well. Jim Freeman is preparing our after-action report for that. And we also have reached out to funeral home and mortuary facilities in the county as well, because it's a unique and specialized group that would be there to support the needs of the community should we have an Ebola outbreak and we end up with deaths. So we'll be doing that very soon as well in the very near future. Something that you might have been aware of from media reports, if you will, on page 2, Cloud9 is a synthetic chemical product that has been marketed mostly in southeast Michigan. Macomb County's had the biggest problem with it. They've had quite a bit of ED visits from teenagers who have used this product. It is illegal to purchase. Unfortunately, it falls in the same category as K9 and Spice, which are synthetic cannabinoids that we dealt with a few years ago. It's very difficult for law enforcement and the courts to keep up with these products because once we put them into the controlled substance schedule, we specify the chemical compounds that are illegal. Frequently what happens is they slightly change them so they no longer come under the jurisdiction of the regulation. So anyway, what we wanted to do was kind of get the word out to the community that we have concerns about this and ask our community partners in retail, through convenience stores and so on, not to stock the product and to remove it from the shelf. So that was signed by myself, the sheriff, prosecuting attorney, and the Substance Abuse Prevention Council. We're doing a lot of work pretty much across the department on things that are either continuous process improvement related or quality improvement related, if you will. We completed a rather lengthy self-assessment tool at the health department that we were able to pull from the National Association of City and County Health Officials. We found it to be very helpful in walking us through all the domains that we need to be paying attention to, both from a QI perspective, but also from a national accreditation point of view. So we'll be continuing to work on that summary report and bringing that to our leadership team for further review and next step planning. We're working on a Wi-Fi system development in the department, nothing extravagant, if you will. We have existing small Wi-Fi units that we have now that we have had for many years from Verizon, and we pay X number of dollars per month to support those for field work. What we're finding is that many of them are not really being properly utilized on a frequent basis in the field work, so we're going to deploy them in the building as part of our Wi-Fi system development to support community partners, state office staff when they visit us. It'll be a guest-only network. So we can put that in place without much resources at all. We're continuing a lot of work with Allegiance Health. The survey for providers on behavioral health diagnosis closed on November 26th. We had 51 providers actually respond for a 20% response rate. I wish it was higher than that, but that's what we ended up getting, and so we'll be working with the Research Department at Allegiance on those results. We want to develop a survey also of the independent behavioral health providers in the community, and that's moving forward. We continue to collect data on the overall issue of behavioral health services in the community. You can see on page 3 that I recently received data for inpatient discharges for diagnosed mental health disorders and primary practice delivery settings. We've requested those data. What we want to do is compare them with the burden of mental illness that we understand is likely present in the community to see how much care is actually being provided. So that's our purpose for doing that. We're working on population health measures still. Public health service integration with lead poisoning or lead screening and testing of children continues to move forward. It's taken us quite a while to map out the whole process and how it works and who all the players are in the community. I think what's interesting is that you start asking questions, you get a lot more information and understand who's really doing what in places that you didn't realize they were doing it. So it's going to take us a little time to sort that out. Diabetes optimization team that was formed up earlier this month with myself, Dr. King, the Chief Medical Officer at Allegiance, Andrea Bates, and Dr. Amy Schultz. And we really are trying to make sure that as changes are made in the healthcare system infrastructure, if you will, whether they be financial or otherwise some other reason related, we want to make sure that we coordinate together as much as possible to assure people get continuity of care and don't lose access to services. So that's why we're doing that. Flipping over to page 4. Again, we've been doing quite a bit of work on continuous process improvement. Angie Vidito, our Director of Personal and Preventive Health Services, is working to address a problem with incorrect transportation authorizations that occurred. And as soon as we found out about it, we started looking more in depth at the process. We actually put a buddy system in place at the health department to assure that we don't authorize transportation assistance incorrectly. So that's already in place and we've eliminated that problem. But now we want to understand how that whole process works as well. MIHP productivity, we've put that in place and I think the staff are very pleased with how we streamline it and put it together. So I'm confident that we're going to really focus on the right things now versus collecting data that really didn't relate to the specific work that the staff were doing. Jackson Community Foundation Award, we received a $2,500 award for support of the Early On program, thanks to Barb Bowman, our Early On coordinator, so we're excited to receive that. It's not everything we applied for, but we're grateful for what we were able to get. The car seat safety program continues to be very strong in Jackson County through the health department, and I'm not sure how aware you might be of this, but having a car seat safety program in a health department is relatively unique. It is not a standard present program in most health departments, but we do a very good job of it and do a really good job of helping make sure that kids ride safely in their vehicles. Lead outreach and education, we have been working on that particular grant that's funded by MDCH, and it was refunded, as you're probably aware, for the state's fiscal year 14-15 budget. And we're continuing to focus on home demolitions and the potential hazards associated with home demolitions, both in the city primarily, but some perhaps in the county from time to time. We've consulted with the state about it. There are no existing rules and regulations that specify what you need to do to prevent the movement of lead or lead-based paint and dust from building demolition. So it's a bit of a concern. We haven't reached an end point on it yet, but I just want to keep you informed that we'll be doing some more discussion with state staff that we consult with, and that we'll be talking more with you as well. A lot of activity in teen pregnancy prevention, as you can see from the report. Safetyville is going very well. Rhonda Rudolph, our health educator, has been busy coordinating kindergarten, first grade classes through Safetyville, and it's been very well received, and she's having a great time working with the kids. So we're happy to be able to continue that service in the community. We have 8,158 Jackson County residents that are now enrolled in the Healthy Michigan Plan, which actually exceeded the original estimate by about almost 2,000 at this point in time. So we're very pleased to see that we have that many folks that now have coverage. The Great American Smokeout was held on November 20th. We had a nice display at the health department. And it's an event that really is held every year to try to encourage as many people as possible to try to quit smoking. and we provide a lot of information and resources on where people can go to get support and aid for that particular purpose. Healthy communities, you can see we've been continuing to be very busy with reviewing a grant. This particular grant could have funded an award range of $350,000 to $470,000 for up to 4 years. It was implementing public health prevention strategies for obesity, diabetes, heart disease, and stroke through chronic disease coordinating networks. So we actually sat down with our Allegiance Health partners and Jackson Health Network and my staff, and we went through the RFP and looked at it relative to where are we trying to go with all of our health improvement work in Jackson County. Was this a good fit? Was it not a good fit? Well, what we figured out was that it's a relatively good fit. The problem is it's very prescriptive in terms of what sorts of activities and programs you have to operate, and that in and of itself we felt could create some misalignment between where we're going and our own community action plan. So we decided not to apply for that one. We've worked on some behavioral health science forum white paper series on signage and nutrition education. Nutrition education and marketing campaign associated with the Healthy Vending Initiative here in the county. Healthy food on government property map. I wasn't aware that such a map existed, but apparently it does out there in the internet world. And we'd like to have Jackson County reflected there as well for the Healthy Vending Initiative work. The Building Healthy Communities grant is moving along well. Julie Weisbrod makes sure that we keep on track with what's listed there as far as bike racks, the Loomis Park design and construction of the non-motorized multimodal path. Some other updates there. I won't spend a whole lot of time going on that. I'm going to skip down to environmental health and the household hazardous waste. I talked with Don Haydock about how we did on this particular event, and it's interesting that we actually collected more pounds of waste in our last event, and we spent about half the amount of money. So this has gotten to be more competitive out there across the state on a nationwide basis as well, but certainly in southeast Michigan. So we were very pleased that we could run this event and do it so efficiently, if you will, in terms of the difference between what we paid the last time and what we paid this time. It's about 50%.
Do we have anything planned for next year, or conversations going that this will continue again? And
We would like to
Allocating the
continue to
funds.
do it on an annual basis if the funds are available, and these came from the Resource Recovery Facility funds. So if those funds are still available, we'd like to do it. Okay. Some updates on the animal shelter. We clarified some adoption costs that we put in place during the October Breast Cancer Awareness Month. We didn't reduce any fees for adopting cats. We simply asked people if they were willing to add $10 for this particular promotion, if you will. And 118 people did for $180, so we're very pleased about that. One thing that's not on in my report that I want to bring your attention to, and some of you may have heard something about it, there has been some discussion going as far as back as October about the concept of regionalizing local health departments much more than they're currently regionalized in the state right now. As you may be aware, there are, I guess, what you could call regional health departments now that have anywhere from 4 to 10 counties in them. We have District 4, we have District 10, we have Central Michigan District, which has 5 or 6 counties. So to some extent, some regionalization has already occurred. But there is a lot of conversation and talk taking place both at the local public health level and at higher levels in the state government that's been proposed that we think about perhaps regionalizing health departments to align with the economic prosperity regions in the state. So we're in Prosperity Region 9, which is 6 counties. My most recent review of a potential map of what this would look like in the state would show Jackson County with 4 other counties in a region of 5. That still fits within Prosperity Region 9. I think our fundamental questions from the public health perspective would be exactly what do we hope to achieve with this regionalization approach, other than administrative cost savings, if you will, of some way or another, that help us connect up health with economic vitality. It's Jackson, Livingston, Washtenaw, Lenawee. Did I get all 5? Did I miss one? There's one more. There's one more? That was 4. Okay, I'm not remembering what the other one is, but it's there somewhere. Not Hillsdale, interestingly enough. Probably Monroe. Yep. Yep. So there's there's early discussions taking place right now. The Department of Community Health will be meeting with our MELF leadership on December 18th to get more information and discussion. I think I have concerns about it from the perspective that we have a really good working relationship with our local hospital and our partnership, and I'm concerned about that because regionalization may pay no attention to those kinds of local relationships at all. So I'll keep you informed and bring you more information in the next meeting. And that's my report.
All right, thank you for all of that information. On the top of page 6, your section, the category being Healthy Michigan Plan Update.
Yes.
If memory serves me correctly, about a year and a half ago, it came to fruition, right? People began enrolling in the Healthy Michigan Plan.
Right,
About
April of 2013.
April 2000, thank you. So in that amount of time in Jackson County, over 8,000 residents have applied and been accepted into this plan. But then when I look at my new numbers, you're saying in the last 2.5 months, 1,300 of those came in that amount of time, okay, right? Your number's there.
Right.
My question to you is this: is there a deadline in which is there a time frame in which open enrollment has ended to cause such a significant number to come in such a short time?
I'm not entirely sure whether there's an open and closed enrollment session for Healthy Michigan. I don't really think that there is. There is for the marketplace applications that the federal government is running, but I don't believe there is for Healthy Michigan.
So maybe it was the deadline of the marketplace that brought people to the table to have the conversation and discussion, which led them to this?
Yes,
Could
possibly so.
be the
Right.
line of thought?
Because open enrollment just opened here recently for the federal marketplace as well in November.
Again, thank you for that update. Any other comments or questions regarding the update? All right, the next item on the agenda, I'm sorry. Yes.
What can you tell us about flu immunization for employees and retirees? I see we got an email here recently that you just have received vaccines. And is it the new vaccine that they're talking about, or is it the original one that we...
Yep. The current vaccine that we're receiving and administering is this flu season's vaccine. It's not a new one. It is the one that we originally booked way back in March of this year. The deliveries have been delayed a little bit. It's not a manufacturing problem. It just seems to be an approval and distribution problem. But what we're hearing too is that for one of the particular viral strains within the vaccine, it has shifted, the virus itself has shifted and mutated a bit so that it's not as good a match in the vaccine as it was. So depending on which vaccine you get, I believe we're stocking the quadrivalent vaccine, which covers 4 different strains. Some people are only stocking the trivalent, but this strain of interest, H3N2, is in both of those vaccine formulations. So it's probably not going to be as effective a vaccine this year, but still it's the best tool we have in the toolbox, and we're encouraging people to continue to get vaccinated. I don't have a number to update you for today, if that's what you're asking on county employees. Okay.
Just wanted to know where we're at.
Yep,
in this discussion.
it probably will. Yep.
Any other comments or questions regarding the report? Commissioner Duckham.
Yes, in regards to the flu vaccine, are they tweaking the vaccine to try to cover the new strain that's evolved?
They won't be able to tweak the vaccine to do that. It's the process for culturing and growing the different viral strains is a 6-month process. By the time we actually regrew it and recultured it at the manufacturing end, it'd be too late to do any good.
Thank you.
You're welcome.
All right, next on the agenda, there is a issue in front of us, which needs to be supported here and moved to the full board. The contract we currently have with Allegiance to share the duties of the health officer. Again, Allegiance Health shares in 49% of the cost, and with the agreement with Jackson County, and we are looking for a motion to continue on with that relationship and renew that contract for another 12 months.
So moved.
We have a motion and support. Are there any comments or questions to further this conversation? Seeing none, all in favor say aye. Aye. Opposed, the same. Motion passed. It will go
Thank
to
you.
the full board.
Thank
Thank you,
you.
Richard. Next on the agenda, we have the claims, the November claims.
Support.
We have a motion and support. All in favor say aye. Aye. Opposed, the same. Motion passed. There are no other minutes in our board packets. We have a January reporting schedule of Department on Aging, Health Department, Lifeways, Animal Shelter, and Veterans Affairs. Next on the agenda, we have public comment. Are there any individuals that would like to address the Board of Commission? Seeing no individuals wanting to address Human Services, we'll move on to committee member comments. I would like to add as our final Human Services Committee meeting for the year of 2014. Thank you for allowing me to serve as chair. It is my privilege. I also would like to publicly thank one of our outgoing Human Services members who is not here currently present, but she has served the committee well for many years, and we appreciate her support. Any other committee member comments? Commissioner Rice, you have been extremely quiet. We're doing okay? Just checking. Okay. Finally, we'll adjourn to the call of the chair.